Welcome to the Cultivating Health Equity Stories podcast. In this captivating series, we delve into the heart of health equity, sharing stories that illuminate the path toward a fairer, more inclusive healthcare landscape. Our mission is to amplify voices, challenge norms, and inspire change. Here is your host, Dr. Throy Campbell, a research scientist on health equity issues.
Tracy McLeod, whose remarkable journey of resilience and advocacy inspires us all. As a cancer survivor, Dr. McLeod offers a unique perspective on the challenges patients encounter within our healthcare systems. Tracy's story will deeply resonate, balancing her professional career and her role as the primary caregiver for her mother, who also fights the dreaded disease, exemplifies Dr. McLeod's remarkable strength, compassion, and commitment to excellence. Dr. Tracy McLeod, I'm so happy to have you on the show today. How are you doing?
I'm good. Thanks for having me here in actually sunny Connecticut. I mean, the temperature is about high 40s, 50s. We're stepping into spring, not quite yet, but I'm happy for it because it adds to all my pre-birthday celebration, right? But I'm happy to be here. Thanks for having me.
Right.
How are you?
I will say happy birthday in advance. This is your pre-interview.
Yep. Thank you.
Pre-birthday interview.
Thank you. How are you?
I'm doing well. It's nice out here in Texas. Myself, I'm starting to put my spring plants in the ground, and I'm looking forward to a fruitful season.
Okay. I haven't started yet because it's still cold outside. The frost is still there, and so it will ruin our gardening experience. But eventually, we'll get around to it.
Yeah, we have something in common. I know we both like planting.
Yep.
Anyway, let's get into a conversation. Let's get into a conversation about healthcare, health equity. And can you share your journey as a cancer survivor? What were the most significant challenges you faced during your battle with cancer, and how did you overcome them?
Just for a little bit of context, how I came to my health struggles and then kind of work my way into the actual challenges that I face within the system. And so fresh out of graduate school, and my first job was extremely stressful. Really, really stressful. And at the time, I was also actively caring for my mom with her recent diagnosis of cancer as well, advanced stage multiple myeloma cancer. And this position was in New York, and my mom had lived with me. We're just going through her journey. And maybe about a year and a half in, I find myself struggling with some health inconsistencies within my body. The first being extremely fatigued, tired, no matter how much rest I get at night. At first, I chalked it up to just having an extremely stressful last year of finishing my graduate school. You've been through it, so you know what that is like, writing the dissertation and so forth, layered with caring for an ill parent, right? And then transitioning from Miami to New York. So I just chalked it up to the transition moments that I was going through in life. But then it never changed, right? When I started noticing a couple of symptoms in my body that came and decided never to leave. I had some swollen lymph nodes in my neck. I wasn't having like a fever, flu, or anything like that. There were just some symptoms that was so pronounced and they never left, meaning I gave it a week, 2 weeks, 3 weeks, a month. They were still there. And then I began to reach out to my doctors, as a sign of caution, just for them to check it out. And in that time, it wasn't as receptive. In fact, I felt like I was the only one as alarmed about these symptoms. The providers weren't. And so kind of fast forward into the crux of everything. I took another job in the New England region, Massachusetts to be exact, and moved to Connecticut. And then I realized that the symptoms and the struggles I was having with my health followed, right? So even though I changed from a stressful job environment to somewhat a little bit more relaxed or not as stressful, and I was enjoying this job much better. I enjoyed working with my colleagues. My health symptoms persisted. And I figured since I was in a new location, let's try new doctors and see if they would be a little bit more receptive to the medical concerns that I was bringing to them regarding my own body. I would say yes, they
Right.
were receptive, but still very cautious. I don't know if cautious is the word. They were apprehensive. I guess that's a better word, apprehensive. And so while they
Right.
listened to the concerns that I had, they didn't see it as alarming, right? And so they took their time. In my view, I would say they were dragging their feet. And I think part
Of
of
course.
the slow movement had to do with, I am not sure she's really experiencing these things. She's saying it, but she doesn't look it, right? And that's how I felt things were moving.
I'm sorry, and you're telling us quite
Yeah.
well. You're doing a good job, Dr.
Thank
McLeod. But
you.
I wanted to probe just a little. When
Yeah.
they say she doesn't look it, you are a African American healthy lady. Is that
Yeah.
what doesn't look it is? Can you
I-
speak to that?
What I understood that not look it to me is that here I am describing what I am feeling on the inside, but what is physically in front of them doesn't align, right? So I'm saying I feel extremely fatigued. I will fall asleep at the drop of a hat, even if I slept the whole night, right? And to them, I did
Right.
not look as fatigued as I was making it out to be. When I spoke about the swollen lymph nodes that
Right.
I've had in my neck, they would get up and feel the lymph nodes, but they're like, I see
Yeah.
it, I'm feeling it, but it's not swollen enough to be as alarming as I am making it out to be, right? So I felt like that was some sort of gaslighting. And I have to say, throughout much of my journey, there were a lot of medical gaslighting, right? Whereas, like, I'm not going to try and compare my mom's experience to mine, but there are parallels within it. And having been her
Mhm.
primary caregiver for these years, for my mom, the gaslighting wasn't so much because she had very glaring symptoms and conditions,
Symptoms.
right? And she was heavily in pain. So they were a lot more receptive to hers. However, the challenges that I faced with my mom were along the lines of, financial and some other challenges that was very different from what I faced. I had to deal with a lot of, are you here because you want to be here for something else, right? Or you just love visiting the doctor? Like, I
Right.
mean, academia is
I think
very
that
busy. And so if I want to spend my spare time doing something, it wouldn't be at a medical facility for sure. And so when I'm there for a reason. So in the initial stage, they really dragged their feet. I remember my doctor saying, oh, you're anemic, so I'm just going to put you on iron. And at first, he placed me on iron pills for 3 to 6 months with follow up. And then when that didn't work, it's like, oh, you're having issues with absorption of the iron, and that's why you're fatigued. So let's do liquid iron for another couple months. And then that didn't work. Let's do IV iron, where I had to go in and get infused. And then that didn't work. And then they're like, there must be an underlying issue. And then with my advocacy, because I wasn't going to let up, then finally, some referrals were made to a variety of specialists, including oncologists. And, that was really an eye-opening experience. So my journey wasn't as
so
smooth.
I want to probe a little. I also want to make a correction to a statement I made. I refer to you as an African American, who you're Afro-Caribbean, and that of itself is significant because people see you through certain lenses, which can
Lenses.
be completely incorrect.
You're right.
However, you said you're making the point of a delay in the providers diagnosing your health condition because of their own perceptions, their own biases, their own. Can you talk more about that?
It was a battle between my providers and my health. And the gaslighting was far more painful than the slow diagnosis, because here I am coming to you, my provider, who I am trusting that have the knowledge, the expertise to make sense of the symptoms that I'm bringing to you. And instead of being open and let the data that I'm providing guide you to make a decision, you are questioning the data and you're questioning the quality of the data that I'm providing that you have no knowledge of, because you don't have my body. You don't know what's going on, right? And you are making it seems through your words and your actions that I am lying. I am trying to deceive you. What would be the point of that? And making it so that to me was far more painful. So I even had a provider, my oncologist, that I eventually switched because we got into some heated conversation. One of her initial encounter was something of the sort. It's like, why are you here? Right. And that question just let me know that she did not trust the reasons I was there. She had another perceived reason.
The reasons you were giving her.
Right.
Yeah, right.
And so she had another perceived reason as to why I was there. She presumed that I was making, embellishing my illness for medication purposes, to get medication. That was painful for me, right? Your symptoms are not as pronounced as you're making them out to be. Typically, when we hear patient come or see patient come in, they have these glaring symptoms that we can determine that they're ill. You don't have them. And if you don't have them, you should not be here. And in essence, it's like you're telling me to wait until I am completely broken before I can get proper treatment or diagnosis and proper treatment.
That is a huge problem. That is a huge problem.
It is a huge problem because far too often people give up. When you're going through the process and you have this medical gaslighting and you have to advocate and these unnecessary roadblocks by your providers, you're like, okay, I can't be bothered. And as a result, you stay home and wait until you're completely broken when little to nothing can be done. And then by the time you go through the actual treatment, there's no coming back. So
it's too late. We're talking about your health here.
Exactly.
So it can be too late. And I want to say that you have this unique lens on because you are a professor, you are an educated person, so you can understand what's happening in the interactions. There's some who don't. The provider is the person of knowledge, of power in the situation. And so you made a few good points, a number of good points. The fact that it's your body, you know your body, the provider should listen to you, right? Then two, your background as an educated woman is being disrespected, I think, because they're not listening to you. They are stereotyping. And these are challenges that we have in the healthcare system that really delays diagnosis. And again, imagine the health consequences. How long did it take for you to be properly diagnosed? And tell us more about that.
It took close to a year. Actually, it's a little bit over a year. It took for me to finally get to the diagnosis. Even though I was referred to the oncologist, I had a battle with the oncologist, which it was really a struggle. I thought my primary care did a slow walk. This oncologist, it was rather rude. When you talk about serious gaslighting, I recalled her coming in the room and right away she had an attitude. I think the first time I met her, I chalked it up to like, it's a long day for her, many patients. I like to give people grace, right? That is just me, a part of who I am. I just don't jump to conclusions right away. And so the initial encounter was very bad, really poor. And that particular day, she's like, oh, you're young. As if illness, whether cancer or otherwise it doesn't discriminate. There's no age discrimination when it comes to health, right? And so right away, she's like, you're young. I don't see the point for this referral and so forth. And I began to ask a slew of questions based on second of all, she didn't want to hear the symptoms that I was presenting. So she was very dismissive. It's almost as if she was doing me a favor to hear me out. Have you ever gone to like an office in general to meet someone and it's like they're giving you a courtesy meeting. And so, they want to do it, but they don't want to do it. That's the vibe I got from her.
Do you mind telling us a little about the background, the demographics?
It was a female, but so my oncologist is a female. That's actually a very good question. And I want to say she identifies as Indian, right? She's of that descent. And so it's a woman of color. And you'd think that...
That's the point.
Yes,
Woman of
she
color.
is a woman of color. And so you would think that as a woman of color to another woman of color, both educated, granted that we're in different spheres of, the education realm and expertise, but we are both educated and professionals. And so I did still give her grace on that first encounter, because I do know as a woman of color, navigating any system, it can be challenging. And sometimes the system wears us down to the point where we inadvertently exhume all sorts of attitudes. So that was my grace point there and then.
Yeah.
That first meeting, she decided that she was going to send me further into a slew of other providers, like a GI doctor, I think an infectious disease doctor, an ENT, a slew of people, with the exception she did not want to look at anything hematology, blood related, right? So at first when I went to her, she's a hematologist, oncologist. So the oncology part is for the cancer. We weren't looking at that first. We were just looking at blood related issues because my blood count wasn't responding the way it should be. So she didn't offer to do anything relating to blood. She just, I was about to say send the fool a little further, but just to other providers. Something happened in between my next visit. I think she gave me like a 3-month appointment to follow up with her when I went and do all of these tests without any additional treatment or any treatment at all. Something popped up. I can't remember a new symptom popped up. I think I had this complete breakout on my body, which was another symptom, like rash all over my body, like this deep purple hue. And I became so nervous. So I went in to see my primary, who in turn said, you need to go back and meet with the hematologist. And this was my second encounter with her when the question was, why are you here? Like, I'm here because I have these new symptoms that's popping up. And it's like, why are you here? Right? You're here for something else. It can't be just for the rash, right? She was annoyed. This time I didn't have the same grace I had in the initial stage. And so I was going to advocate for myself in no uncertain terms, in a respectful way. And so I let it be known that I'm here for the conditions and the concerns that I have that's going on in my body, and you have the expertise. So I'm going to provide you with the data to help make that decision so we can move forward. And that was my approach. And so she was somewhat dismissive, which they can be, right? And I just simply say to her, what can we do? Is there any tests? Because you've sent me out to these places. They've done their tests. What are you going to do? And that was a trigger point for her. I don't know if she's not accustomed to patients asking. And then she's like,
those questions,
she repeated, you're young. I don't see these symptoms are not consistent with what I've seen in the past for someone with any sort of health, blood related illnesses and so forth. However, there's one very sensitive panel of testing that I'm going to order, and I'm just going to order it because I can't remember verbatim what she said. But what I walk away with is I am going to order it just to shut you up. Since you're asking, I'm just going to order it to shut you up or to cover my back. And so that appointment was very verbal and loud. The assumption of I'm there for meds, right? And not for the real reasons. I also took offense to the gaslighting that was going on. Like, this is my body and you're not listening and you're very dismissive. And on top of that, you're being rude. You're asking me to advocate for myself as a patient, but yet still you're being rude. And so to get her to finally order that test, I had to raise my voice. And,
that's a shame. That's a
Yeah,
shame.
long story short, the test came back and her office called me to come in for an appointment. So once that happened, I knew. I think the other painful piece of this, and cancer is a journey that, at least for me, I don't know, maybe this is a stretch, but for me, my health, and even just for my mom, you reflect on it, it gives life a different perspective. And I wasn't so much fearful of what the diagnosis was. That wasn't my fear or my concern. I just felt like once I knew, I could deal with whatever that is. But even to this day, the pain was how the providers treated me. That was the trauma of it all, because
Right.
this woman gaslit me. And when the results came back and they lit up like a Christmas tree, she never said, "I'm sorry." She never said,
Sorry. Well,
"I didn't trust your judgment with your body." She just pretended as if nothing happened. And she's like, "Based on this test, we need to go further." And the other piece with all of this, not just with this provider, but just in general, the appointments, they're not quick. In some case, it's almost as if you're in a developing country. So I just had a blood work that lit up like a Christmas tree, saying that there are indication that there's something very serious going on in your body. This provider is going to make recommendations for a few other tests in order for them to complete the diagnosis, such as an MRI scan or some sort of CT scan. You would think, being in a developed country, that you would be able to get that scan within a week or two. No, it can take a good month or months.
No, that's a shame.
For me, that was hard to deal with, especially when you have something that is potentially life-threatening. Because cancer can be terminal in just a second, right? And so to wait months or weeks for a simple scan, and then to go back in to see the doctor for the reading of the results, that to me was like, okay, I'm not in a third world country. I'm not in a developing country. So it could be a little bit more efficient. The other piece is, the more complex the assessment that is needed to help with the decision, the farther out the appointment is. So I had to do bone marrow test and aspiration for the stage, just a whole slew of things. And those were appointments that were taking weeks or months out, and in between, nothing can actually be done. So that's a part of the reason why the diagnosis was so long. It took so long. And then, not to mention the emotions and the variety of stuff that goes on.
So can we talk about that somewhat? Can we talk about that somewhat here? Because you mentioned interpersonal challenges with your provider. You mentioned systematic challenges which cause a delay, right? Which is detrimental. Now, as a professional, you're a professor and you're primary caretaker of your mom. Can you talk about how you dealt with those challenges, caring for yourself, caring for your mom, and so what sort of support you had? How did that go?
That's actually a very good question. And it took my own health to realize that I did not have a good support system in place for me. I have always been a support for others, but I personally felt like I had to walk through the journey on my own. There was some support, but perhaps not the way I would have loved them, or perhaps not the way when I'm giving support, I give support, right? And so I felt like a good 90% of my journey, I had to walk through that on my own. And that to me was very painful.
On your own?
I had to walk through it on my own with dealing with my providers, right? In terms of advocating for myself and making sure that I'm supporting myself through this emotionally, not giving up, and just making sure that no matter the hurdles, the roadblock, I'm pressing my way through to get to the root cause of how it is impacting me. Yeah, my colleagues. I did have colleagues who supported the way that I think colleagues should support, or the expectation that is there. I really didn't have
Well,
much
if I might
yeah.
probe, if you can speak to the specificity, you're going for treatment. What's the
Yeah.
support? A day of treatment. I know the audience would like to understand your
By
personal
the time we get
experience.
by the time we get through the diagnosis and everything like that, remember I had a full-time job and I was working. I eventually had to take a
Right.
medical leave of absence for one semester because it was
Mm.
just too much for me to deal with. I wasn't certain of the ramifications of the meds and working full time. And thankfully, I'm happy that I eventually took the medical leave, because going through the process of treatment, I could not concentrate. I could not even read a book because steroids was a part of the process, and that is it was a crazy side effect that I had of it.
Right.
Matter of fact, I was wired, like alert, awake all the time during this start. So in terms of my job provided the opportunity for me to take a full medical leave for the semester off with pay. I didn't have to worry about the financial aspects of it. And then my department was truly very supportive. I actually had a colleague in my department who I would consider a brother, him and his wife truly rallied around me. They're Jamaicans as well, so that was helpful. He took me to some of the appointments that I had where I could not drive, and his wife would make like soup for me during the process. So that was good support. My department checked in on me. My students really, checked in and to make sure that I was doing well. In terms of like family support, I was a little bit disappointed with that kind of support, just because I feel like, regardless of how your family structure is, I feel like I've done quite a bit for my family. And I'm not saying because I've done that I should be given. I'm not saying this tit for tat, but
You were
I'm
in
in
a
the
place of
US.
need. You needed them.
Yeah, exactly. I'm in the United States. My family, for the most part, is in Jamaica. And so support doesn't necessarily have to be financial. It could be just a phone call, just a check-in. And so those weren't as, what I would have hoped and expected. And so I had to rely mostly on the friends that I've made as a result of being in the United States, friends that I've made along the way, yourself included, and other, friends, through college, through work, and so forth, have, become that support system for me. And most importantly, just my own faith, right? Leaning on my own faith, sort of encourage me, to support me, and knowing that even in spite of everything, the good Lord is with me. He would not give me more than I can bear, right? Yes, there were times I wish I had.
I admire your.
Go ahead.
I admire your faith. I admire your faith, and it must have been a challenge. It must have been a challenge. I'm going to try to do something here, Dr. McLeod. I'm going to come back to your story. We're going to come back to your story. But at the top of the show, we mentioned that your mother also struggles with the dreaded disease.
Thanks for listening to Cultivating Health Equity Stories. Remember, our mission is to amplify voices, challenge norms, and inspire change. Go to cultivatehealthequity.com, sign up on our email list, subscribe for future episodes, and find the resources mentioned in the show notes. Until next time.